Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This is very special today because I have had a lot of questions about delivery of prescriptions. And I'm here with two people who really are such experts. And it's, I'm just going to say, ARMEN and SHITAL. May I just do it that way?
Yes.
Okay. And I got to get you in here, and I'm having a little trouble. I'll try it this way. That's right, because you're both so attractive. I want to do it. The thing that I really need to tell everybody is most people are on some sort of a prescription. And you know, it is a pain to get them renewed. It's a pain to go to the pharmacy and wait for it. And if you're sick, you have to go stand there. So this organization, these two people started this company, Pharmco RX, which really will alleviate all that. And I'm going to why don't you start off, SHITAL? Why don't you start off and tell me? Let's use my example. I went to the doctor, and I have a prescription that has to be filled. So instead of going to Walgreens and waiting and then having to remember when to take it, see, that's the other part of it. Tell us what your organization does that benefits them.
So we take all of the work out of getting your prescription. When you go see your doctor, all you have to do is tell them you use Pharmco Pharmacy. They can find us through their eScript platform. They can fax us a prescription. They can call it in. A patient doesn't have to do anything to get us a prescription, but if they want to, they can. They can come in. They can send us an image through our new Pharmco platform. There's a lot of ways to get us a prescription without ever having to leave your home. Once we have the prescription, we handle everything from getting it to billed to your insurance, working with you on copays, working out delivery times, and then getting that medication to your home, to your business, wherever is convenient to you. And all you have to do is accept that delivery and take your medication. If you have multiple medications and get confused very easily about what to take, when to take, what your medications are for, we have this great little solution.
Exactly.
This is our Pharmco Smart Pack. It pre-sorts all of your medication.
Why don't you open it?
Into these convenient pouches.
I like that.
So each pouch has all the medications you need per dose. So you don't have to worry which ones go with what. You don't have to worry about whether you need food or not. Everything's on the pouch.
Fantastic.
You just pull it out. And if you lead an active lifestyle, you don't have to walk around with a lunchbox full of meds. You just take your three pouches for the day, put it in your purse or a carry bag, and go about your business, and you don't have to worry about anything. So we make things simple. And let's say something happens and someone changes your medication. You go to a doctor, you need something else. You call us, we'll pick up the medication from you, fix all of your pouches, and send it back. So you're never without meds, and you always have the right ones.
Okay, Armen, this is brilliant. And so let's just go back, though, to, I know you started this because you somehow, I don't know if it's personal or what, you thought that this was a great idea, because I don't know anybody else doing this with the kind of experts that you have. So it's a pretty important company.
Yes, it is. It is an important company. And it is important today more than ever. And the reason being is because of the way that healthcare is structured, right? It's more and more important for doctors and for patients to make sure that the therapies everything is about preventive medications, right? Preventive care. So without the medications, without taking the medications the right way, without taking the right medications and taking the medications the way that the doctor prescribed, you won't be able to be successful with, and have positive outcomes. So it is our mission, as I said before, and I always say, our mission is to make sure that you're never without medications, but also our goal is to make sure that you are taking the medications every single
correctly
day.
Too, though, right?
Correctly.
So,
Right.
so what happens? How do you keep someone from forgetting to take their medication?
So one of the ways we're investing into technology, and this robotic system, the packaging system that SHITAL just went through, this is one of the ways to make sure that the patients are taking the medications the way that it's prescribed, because you don't need to have multiple vials. You don't need to think about which one and when do you have to take. You're taking it as it's packaged for you because it's packaged as the doctor prescribed it. Now, also, we have staff that is dedicated to nothing but calling patients every single day they're doing nothing else but calling patients and making sure that the patients are taking the medication. They're asking the question, they're asking whether the patient has adverse reaction to the medication, whether the patient has any type of side effects that they haven't felt before. We communicate that if there's any issues. We communicate it with physicians, whether it's specialty physicians or primary physicians. So it's an alliance between us, patient, caregivers, whoever's involved in a patient life, that it gives the patient that type of care.
You know what I call you? Advocates.
Yes.
That's really what you are, because most of the time the doctors are just too busy to deal with this. So you are that extra arm. I love this.
Yes.
We're advocates. We're coaches. A lot of times you speak to a patient, I don't want to take my medication. I don't like medication. I don't want to do this. I don't believe in it. And you go through and you realize that the patient has diabetes or hypertension or high cholesterol or any number of ailments where medication will really make a difference in how well they lead their lives. And we have that staff, those people that care, will look you in the eye and go, this is going to make a difference for you. And we provide that coaching, that support, that system. And you say, oh, but this is not treating me right. We don't neglect you. At that point, we call your doctor. Do you need something else? Do you need a different manufacturer? Do you need a lighter dose, a greater dose? Whatever it is, we will work with your doctor, because at the pharmacy, we should be the experts in medication. We use that.
Okay, and I just want to know, Josh Hoffman is watching, and he says, hi, Anita, always bringing always bringing great information and great guests to your audience. Oh, good. So, Josh Hoffman. But let me ask you about supplements. So let's say that I take, probably 5 or 6 supplements also. Do you take those supplements? Do I have to send you the ones that I have because they're special, and then you'll include them? What do you do?
So we have a full stock of every kind of supplement or vitamin or mineral, anything that you could possibly need. We have some of the highest quality brands in our store, organic, non-GMO, these perfect groupings of supplements and vitamins that we can even provide guidance to you. If you're taking certain medications, you might have more depletion that you're not aware of, and you need a CoQ10, you may need more vitamin C, you may need something else that will actually enhance the ability of your medication to be effective. But let's say you're just on supplements and not on medication. You can tell us the list, and we can package them in the pouches for you.
Oh, this is fabulous.
Or we've had patients bring their bottles in, and we package them.
Right.
Or we can, make the recommendation to you and provide you with everything you need. So.
And people are probably thinking, so how do you get paid? How do I have to pay you?
So if you have insurance pays us. If you have a copay, there's lots of ways to pay. We accept all major credit cards, check, cash, whatever works for you. If you are paying cash, same thing. We'll work with you. We offer copay assistance. We offer payment plans. We try to make sure there are as little impediments to getting medication as possible. And we don't believe that cost should be one of those impediments. So if you have trouble, we will find a way to make it work.
So Armen, are you now in nursing homes, rehab centers where they're going to be able to do this? Because I think your service is extraordinary.
Yes, so we are servicing some of the rehabs. We're servicing some of the assisted living facilities in Dade, Broward, and in Palm Beach as well, and growing, and try to always grow. We specialize in adherence, right? So whether it's adherence in a skilled or non-skilled setting, or it's retail patient, doesn't make any difference. Everybody's got the same goal in mind, and making sure that patients are getting what they need and getting the communication with their doctors and whoever's involved in their life. And so that's what we take care of. So our services are in demand in any kind of setting, whether it's skilled or non-skilled setting right now.
Right. So people who are at home, I think they don't have to be in a hospital, or they don't have to be in a rehab center. They should just call you and order it, just like
Absolutely.
I'm going to do, right? And you should do it. So doctors are great, though, I would think, because everyone should maybe call their doctor and give this information to their doctor so that the doctor can handle the prescriptions.
Well, it's in the best interest of a doctor to work with a pharmacy like ours, because doctors today are rated based on some of the measures, right, and which is probably about 50 to 52% of their success based on adherence measures. So if they work with a pharmacy like Pharmco, then being that Pharmco is a top performer across the board, whether it's Humana or it's Express Scripts or United or AARP, and it's a 5-star pharmacy, then your patient will become a 5-star patient, and that means that the doctor is going to be able to increase the stars for their performance, as well as have better outcomes for their patients, as well as get those type of bonuses that they would
I see. I didn't know how that works.
They would not get otherwise.
I didn't know.
If they don't meet those type of measures.
I didn't know that's how.
So we are the preferred pharmacy when it comes down to physicians and MSOs and ACOs that understand the value of the services and the value of meeting measures and having their patients 5-star.
So Shital, let me though pursue this further. Let's say that my prescription is going to run out. Do you take care of getting it renewed?
Of course.
Because you call the doctor, and
yes.
then if the doctor says they have to come in, then you will communicate that with the person.
Of course. So we take all the work out of managing your prescriptions. We know when your refills are going to run out. We know ahead of time. So usually about a month before, we will be in communication with your doctor about whether they want to reauthorize this prescription or whether the patient needs to come in to be reevaluated. And we will communicate that with the patient, that you need to go make an appointment. We have even made appointments for our patients. We communicate, we go back and forth, we do a big conference call, and we get them all together and all on the same page. And all of that is to make sure patients have the easiest time of getting medication, taking medication. They don't have to do anything.
When you hit the 1 million mark, you're going to be in trouble. Who are you going to send out? Little puppy dogs to take care of this?
No puppy dogs, no.
No puppy dogs.
No, you can never lose that human touch.
Yes.
And that's what separates us from everybody else, because no matter how big we're going to get, this is our mission and our promise, and that we're dedicated to make sure that there's always that human touch. There's always a line of communication. There's always unlimited access to our staff, including pharmacists. We're not like Walgreens, we're not like CVS, where you have to be on hold for God knows how long in order for you to be able to connect with somebody in the pharmacy department. This is unlimited access, on demand, whenever it is that you need to speak, whether you're a physician or a patient or a nurse or a home care attendant, doesn't make any difference. You will be speaking to the staff.
Okay, and I have one. We talked about puppies. So my dog has Cushing's disease, and he's on pills. Are you going to deal with the vet? Are you dealing? We probably hadn't even thought about that.
No, we did think about it many times.
Yeah.
Unfortunately, we can't be everywhere we want to be at the same time.
Maybe in the future.
Yeah, we have some patients, believe it or not, that because we do compounding. So because we're custom compound pharmacy as well.
That's very good to know.
Some of the patients come to us and they find out about the fact that we have compounding department, and they ask us if we can make it for their pets as well. So we do that.
Okay. See, so that's like on the side. The other thing is that now with the Cbd oil, are you carrying any of that?
So
I'm glad, because let me tell you, Josh Hoffman is very big into that. That's what made me think about that. He does a lot of this. So tell me now what you do.
So we do carry a line of CBD products, and we're in the process of developing our own line of CBD products. The point being is we feel there is a lack of education in the marketplace about CBD. Many patients get it, don't know how to use it, don't know how much to take. And we have studied this for several years now, and we know how to help patients and guide patients on how, if they're using it oil on their knees, if they're taking a capsule, if they're taking a lozenge or a gummy, how that's going to impact their body and how they should expect to feel upon using it and what kind of relief they can expect. So we give them realistic options and realistic information, and we try to make sure that we treat this as holistically as possible.
I need to put you in touch with Josh Hoffman. He is brilliant. He knows about all this, and that would be a great pairing up. I want to talk to you.
CBD is for real, right?
Oh, I know it is.
We've learned that ourselves, and we've learned it through using it ourselves, right, and trying it, and also having people that we know
Right.
that also in the healthcare community that are doctors or their relatives
Yes.
that today receive CBD products from us because it's helping
Well,
whatever they,
So I have a dog
conditions they
story.
have.
I have a dog that is a Bichon. I'm sorry, excuse me. It's a Shih Tzu. I had a Bichon before. Shih Tzu. And when I adopted him, he had half of his tail was like a rat tail and the other half had fur. So Josh Hoffman put me onto this CBD oil for pets. My dog now has a full furry tail. And people say, well, if I did that, would it grow hair? I don't know if it grow hair in the head, but I do take it at night. I take a couple of drops. So I want you to know, I'm glad I brought this up because that can be a very big business.
It is for real. It is part of our business plan, but everything we do, we do from a point of view of clinical point of view. Not, we don't take retail, commercial point of view of that as a business. We make sure we put enough we invest enough time and research into it to make sure we can deliver the product.
Yeah, so we're a great resource. If anybody wants to call, we have a great set of pharmacists, highly knowledgeable, who will provide consultation and information on anybody who's using medical marijuana or CBD, on how to use it and how best that integrates with their own medication, because people a lot of times don't think that CBD has anything to do with anything else, but CBD can increase or decrease the concentration of certain medications in your blood. So it matters to know what you're putting in your body and how that's going to interact with everything else.
I am so glad you said that. Let me tell everybody your phone number again. Remember, this is Pencil Talk Radio. Phone number 888-919-7411. Again, 888-919-7411, and on the web, PHARMCORX.com. Pharmco, PHARMCORX.com. Be sure you call them because I don't know what else they're doing. We never discussed this before, so that was perfect. Well, I'm glad you called in, Josh. You flagged me, but I think that you really are. You're revolutionary. You're really on the cutting edge, aren't you, in what you're doing?
Yes.
We're trying to take a different approach to healthcare. We know that a lot of people, when they think about healthcare, they think about doctors, they think about hospitals. The last place they think about is home. And most of your healthcare is happening at home. And who touches you more, who interacts with you more when you're doing home-based healthcare than the pharmacy? You're talking to us, you're getting your Tylenol, you're getting your supplements, you're getting your medications from the pharmacy and the pharmacist. And so we want to be part of that healthcare conversation, and we want people to see their pharmacy and their pharmacist, and especially PharmCoRx, and especially us, as clinicians, as part of that healthcare conversation.
Why don't you pull that out again? I want you to show that to people. Pull that out. It's a great idea.
A lot of people are familiar with the advertisements that they're seeing on Facebook. This is the same stuff that PillPack has, if you're familiar with that. It's the exact same machine. So we can do everything they do. We just do it for free. So if you just pull it out,
fabulous.
You tear, you take whatever you need. You don't have to worry if the right medication is in there. And everything is labeled for you.
This is wonderful, absolutely. Well, I am definitely going to, my next prescription, I'm going to give it to you. I don't have it with me, but I'm going to call. I'll call and get you, and then I'll be your great coach or your cheerleader, right? Yeah, that's really a wonderful thing. So do drivers, so let's say I'm not home and I need my prescription. Do they make arrangements when to come, or how do they do that?
Yes, so we have, we've been delivering medications for now over 10 years, 11 years. So we've gotten very good at it. And one of the most important things is communication. So our staff is trained to communicate with patients to find out whether they're going to be home, what time they're going to be home, what are the best hours and most convenient hours that we can reach them. And if we come and for whatever reason they're not home, let's say their plans have changed and they have to get out, we leave the note that we were here. Here's the phone number. Give us a call and we'll redeliver it. So there's never a problem getting your medications on time. And I want to point something out. It's very important because a lot of people think that when it's delivery, that it delays any process. It's not. It's not a problem at all. With Pharmco pharmacy, you will never have a delay in delivery of your medication. So even if it's an antibiotic or any medication that the doctor wants you to take the same day, they want you to have it ASAP. All you have to do is let us know, and we will make sure that you get that medication the same day, no matter whether you're in Dade County, Broward County, Palm Beach County, Martin County, or St. Lucie County.
Yeah.
You have really expanded. I am really excited. We have another person, Melanie Garcia. Do you know Melanie?
I do.
Yeah, she has a little heart there. Melanie has just called you, right? So that's really very, very comforting to know that. So you actually employ pharmacists.
Yes.
Yes.
So why don't you share all that?
6 full-time pharmacists and part-time pharmacists as needed. And we employ altogether, Shital, you know the numbers better.
Probably 70, close to 75, maybe just a little bit less, but close to 75 employees, all of them South Florida. I say it over and over again. Our team represents what's beautiful about South Florida.
Oh, that's so nice.
They're diverse, they're smart, they're feisty, they get it done, they advocate for their patients like nobody else. Insurance isn't covering it, we're on the phone for 2 hours getting a formulary exception. We won't let anybody stop you from getting the health care you need.
That's really a good thing.
Yeah, and we'll connect with the grievance department, if anything, and
really?
Speak to them as well while we have the patient and the doctor's office on the line as well.
Oh, my goodness.
So we get things done.
I love this.
We don't stop, at just anybody saying no. Whether it's insurance, whether it's, payer, it doesn't make any difference who it is. We're going to make sure that we put 150% effort into getting it done before we say, there's nothing else you can do.
So
which is very rare.
Do I wind up giving you my insurance information when I call? That's how it happens, and then you just follow up with that.
Yes, a lot of times we get the insurance information from
the doctor,
from the doctor's office.
Yeah.
So the patient really doesn't have to do anything, but if we have to reach the patient for insurance information, it's just as simple as reading it off over the phone.
Well, we're going to see. I'm going to have Dr. Weiss know about this. Her name's Dr. Delia Weiss, and it might be a new person for you. She's general practitioner, and wellness.
Excellent.
So she has a lot of the supplements, and she's very smart. So I think you'll enjoy her. So I'm going to let them know. I think that I'm doing this with you because this will be very important. Okay, so let's also go. We've been talking about adults, but you take care of children. I mean, you're not just dealing. I mean, you deal with pediatric physicians, don't you?
Yes. So we have a lot of products designed specifically for our younger patients. We have pediatric nebulizers, pediatric wound care supplies, whatever it is that a pediatric patient may need. But then we do something a little special, is we know it's very difficult for a young child to take a pill, or a young child to take even the suspensions, even those oral liquids they taste terrible. It's hard to get the patient to take it. We make lollipops. We will figure out...
Like the gummies, huh?
Yes.
The gummies.
You do lollipops?
Yes. So
I can't believe this.
So, think about a patient that really struggles with swallowing. Think about a young child that's really sick. If you have hand, foot, and mouth as a little kid, you can't swallow. So those lollipops actually have a little bit of medicine for the sore throat and the medicine that the doctor prescribed in it, and they can just suck on it all day. And it's important that the parent is educated on all of that, but we can make any dosage form that our little patients need.
I'm so glad you're on the radio. We can't do this in advertising. This is so wonderful that you're telling me this. I've never heard of anything like this. So, do I get a lollipop for my blood pressure medication? Not yet.
Absolutely.
But I know about the compounding, and I thought that's where you were going.
Yeah, just lollipops. You can overdose on that.
Yeah, you can. Oh my heavens!
As an adult.
Yeah, right. It's very clever.
Well, that's interesting with the CBD as well. It's a funny story. We have those gummies, and they're really effective for sleep and anxiety. But we have a lot of patients who go, but the gummies are just so tasty.
Right.
And I took 2 or 3 or 4 of them.
That's right. And they're sleeping.
Yeah.
That's right.
You're
So-
looking at one here.
Yeah, right. No, because I've heard that myself. I know Josh, I don't know if he's still listening, but that's what he used to say. People would come in and they would be running out of gum. He said, "What are you doing?" "Well, I'm eating them."
Yes.
But that's, I'm so glad that I covered this with you. So, I've been covering it in Boomer Times. I've been doing a little article about CBD oil, but never would I have thought that you were doing that. I just figured it was all prescription medication.
No, we offer everything, over the counter, supplements, Tylenol, whatever your healthcare needs are, Pharmco can get it for you.
And do you negotiate the prices with the I guess the people who are making the pharmacies, the pharmaceuticals?
So if you're
how do you do
if you're
that?
a cash paying patient,
Yes.
we have competitive prices. So our prices are fairly similar to Walmart or CVS or Walgreens. For expensive medications, we try to work with the patient to see if there's a manufacturer program that pays for that. We try to do everything possible, but our prices are pretty similar to anything. Our cash prices are pretty similar to anything you'd find out in the marketplace. We're really competitive. In certain areas, we can be even less expensive.
Yeah, that's really important. I want to give your phone number. I want to give everything out before we have to say goodbye this time. Anyway, this was a great show, though. Go to their website, pharmcorx.com, and their phone number is 888-919-7411. 888-919-7411. Anybody listening to this and you're not doing it, you are really silly. And by the time we have them on again, I'll tell you how the experience is. There's a couple more people. Dorothy O'Connor, Mars, and Julie Bergazon. They're all watching. So maybe we've gotten some new...
Say hello to
Yeah,
everybody.
hello.
That's my mother-in-law.
Okay, thank you very much for being here.
It's our pleasure. Thank you for having us.
Thank you.